Good morning, everyone, and welcome on into North Dakota today. Well, it is a new year and a new reason to talk about children's health. Dr. Stephanie Hanson is back in studio to kick off the new year, and we're talking about performance-enhancing supplements being used specifically by young athletes. So this is new for me, but maybe this is something you at home recognize, or maybe your children have asked you all about it. But what we're talking about is kind of an increase in children wanting to enhance their performance. What's going on?
Well, I'll tell you, I thought of this topic because this is a question I field actually fairly frequently in the clinic with my patients. You know, families asking me, you know, my child approached me about taking this supplement, about buying this supplement for them. Is it safe?
Wow.
Yeah.
So, and we're talking, how old are these children?
Oh, typically that kind of middle school, early high school, you know, on into early college.
Middle school. So kids haven't even gone through those growth spurts or anything, and they're already trying to bulk up or try to get some type of supplement. So is this, I would be assuming boys, but it could be girls as well.
It's both.
Wow.
It's both. You know, there's a number of girls who participate in highly competitive sports or who are into powerlifting, Olympic weightlifting, who are very interested in those performance gains.
Okay, so typically when I think of supplements or when we hear or see advertising, it's for adults. It's geared toward adults.
Yeah.
So what are maybe some of the misconceptions that these families and these kids are having when they read or see an ad?
Well, kids are as prone to misinformation and ads as adults are. Probably even more so because their detector for misinformation just isn't really well developed yet. And so they see something that promises big results. Of course they're going to be interested in that. Of course they want to, you know, improve their game or improve their performance. And so it's really up to us as the adults in their lives to help moderate that and give them some factual information.
Yeah, and I was like, what is the factual information? Because I'm thinking to myself, are there safe supplements for children? How do we navigate this?
Well, there's two things you want to think about in this discussion, which is, are they safe and are they effective?
Okay.
And the answer to those is probably no for both of them.
Wow.
When I think about the effectiveness standpoint, there are things that have been studied. Creatine in particular has been studied a little bit in youth athletes, and what we discovered was no gains in performance, or things that were not worth, you know, the expense or you know, the commitment. So that was really an interesting thing to me was, yeah, you know, this probably isn't going to do anything for you.
Which, that defeats the whole purpose.
Yeah. When I think about nutritional supplements, though, it's kind of the wild, wild west out there. These are unregulated, so this is not the same as over-the-counter medications or prescription medications. So product labeling can be faulty. There can be components, even things that are risky or dangerous, in the product that you're not aware of. Wow. The amounts of the active ingredient also can vary wildly from what's stated on the package. So you may think your child is taking a safe dose of a safe supplement, and in reality they could be taking something different.
What a nightmare.
Yeah.
Oh my goodness, I just feel bad for these poor children who they just want to get better. They just want to seem better at their sport.
So I break the bad news to them of this probably isn't going to work for you and may in fact be harmful.
Yeah.
Their next question is, well, what am I supposed to do?
Yeah, I like that question because is it going to be, you know, good nutrition, good sleep, kind of, you know, those same old.
It is. I feel like a broken record when I talk about it, but it's if you want to make performance gains in any activity, you have to spend time with it. So you need to put your time in the gym. You need to make sure you're eating high quality nutrition. That means getting enough protein, getting enough fruits and vegetables, hydrating appropriately, getting adequate rest. So tough to do for a youth athlete, but that really is an important part of performance as well.
Are there any type of medical exceptions or any reasons that children may need to ever get on any type of supplements?
You know, there are kids who have certain types of metabolic disorders or who may have, you know, other types of chronic illnesses. That's a discussion they need to have with their pediatrician or their specialist, though.
Wow. Okay, and this is something that you yourself have witnessed, parents and kids alike, huh?
Yes.
Oh my gosh. And then what is your reaction too when you see that?
You know, I try to understand where they're coming from, and I appreciate kids who want to get better, who want to have those goals. You know, I think that's a great thing for kids. I just want to give them a realistic view of, you know, maybe the risks involved with supplementing.
Great, because I think you're, you know, letting parents know exactly how to handle this too. So any of your best advice before we let you go today?
You know, always wash your hands.
Stay healthy. Wash your hands. Say no to the supplements. Pass the broccoli. Eat the chicken.
Yes.
Stay healthy.
Yes.
I love it. Thank you so much for coming on, Dr. Hanson.
Thank you.
All right, stick around, you guys. Coming up, we will be digging in and getting crafty with our vision boards. Dr. Hanson might stick around for that one, too. Just kidding. We got to let her go back to work and save the world. We'll be right back on North Dakota Today.